As we told you at the top of the show, the new health insurance marketplace, it goes live tomorrow, and we have been working to make sure that you know your options. Join us again live here in our studios, Kevin Callison. He's an assistant professor of economics at Grand Valley State University. Kevin, thanks for coming in tonight. We appreciate it very much. What do you see? You heard the president talk. Right now, what is the biggest obstacle you see for enrollment with the ACA?
Well, enrollment is still set to go forward tomorrow, so the president's talk doesn't change anything with enrollment tomorrow. I think the biggest obstacle will just be navigating the choice that's available on the exchanges. In Michigan, there are 13 insurers who are going to offer around 140 plans, 140 policies on the exchange. So, it'll be, you'll log onto the website, you'll see the selection, and you'll have to choose which policy best fits you. You
mentioned the politics about this. Should we even be paying attention to the politics? Because as you said, enrollment will open tomorrow. The funding of the government, if the Congress will fund it, it goes to the president. Is that correct? I mean, he would fund his own health care plan.
Right. And the benefits don't go into effect until January 1st, 2014. So enrollment starts tomorrow, but those benefits don't actually accrue until January 1st, 2014. So there's several months between tomorrow and the time that they go into effect.
What can we expect the insurance exchanges to look like when they launch tomorrow? Will this be the finished product, or is there going to be some tweaking going on?
No, I think there'll definitely be some tweaking. If you look at some of these rollouts of programs like this in the past, like Medicare Part D, for example, the prescription drug benefit for Medicare, you saw a rocky start with that too, and then it's streamlined over time. So I think we'll see the same thing with the exchanges. From what I've seen, enrollment isn't projected to be high right away. That'll pick up more as we get closer to the beginning of the year. So I think that they'll start off slow, and then that'll gain traction.
Do we have any kind of estimate on the cost of premiums associated with the plan?
We do. We'll get a better estimate tomorrow when the prices come online. But last week we got to see a glimpse of what the prices may be. So for the average sort of middle of the road plan in Michigan, that price came in at about $271 a month, but that's before the subsidies are applied. And so anyone making less than 400% of the federal poverty level, which is about $94,000 for a family of four, will qualify for subsidies. Estimates are that about half of the people who enroll in insurance coverage on the exchange will pay less than $100 a month for their coverage.
Kevin Callison, you've been our go-to guy here for the last couple of days. We appreciate your insight. An associate professor of economics at GVSU. Thanks for coming in tonight.
Thanks for having me.